got chest pain at the moment? No.
No, just the palpitations.
67-year-old Gary is in resus with a life-threatening high heart rate.
Well, I think we've got you wired up for eternity. You've got plenty of wires. We can keep a close eye on you now, though.
Sats are 98, 99. Have you blacked out at all?
No, I just felt a bit lethargic.
Yeah.
Doctors suspect Gary has got a condition called SVT, which can make the heartbeat close to 200 beats per minute.
SVT can cause your heart to fail, or if you've already got heart disease, it can push you into heart failure.
You seem a bit breathless with it.
Young people tend to tolerate it reasonably well, but older people with other health problems are at quite a lot of risk.
If you develop any pain in your chest, you must let us know.
With Gary's life in the balance, Dr. Austin decides to try a physical technique to lower Gary's heart rate.
To treat an SVT, we can use a type of procedure called a vagal maneuver. Put simply, this is a way of stimulating a nerve that slows down the heart.
So what we're going to do, hold on to that for me, to get you to blow into this syringe. I'm going to give you very clear instructions on what to do, and there's a good chance that it might work. If it doesn't, we're going to give you some drugs that will work. You can lower your mask. I'll just explain the process. So you'll be blowing into that pretty hard for quite a long time. You'll go red in the face, you'll feel like you're going to faint. Okay, and then I'm going to tip you so your head down, like you're going to go upside down, okay. All right.
We'll just keep doing it.
So start blowing now, okay?
So when stop?
Don't press yet.
No worries.
Keep going. Don't stop yet. Keep going, keep going. Blow, 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 blow.
You get someone to blow into a syringe for about 30 seconds till they go purple in the face
Keep going. 5 more seconds.
and feel like they can't carry on doing it anymore.
You can do it. Come on, keep going, keep going, keep going, keep going, keep going, and relax.
You then tip them upside down so all the blood rushes back towards the heart.
Well done, you did brilliant.
This procedure can actually trigger a nerve that supplies the heart that induces it to slow down. And then their heart will go back into a normal rhythm.
After being rushed into A&E with a dangerously high heart rate, Dr. Austin performed a procedure known as a vagal maneuver on 67-year-old Gary.
Well done, you did brilliant.
This is a procedure that will stimulate the vagal nerve, which slows down the heart. And then their heart will go back into a normal rhythm.
Right, you're cured, off you go.
Go on now.
Yeah, off you now. We'll keep an eye on you for a bit longer, okay?
The procedure appears to be a success,
Yeah, would it?
and Gary's heart rate is returning to a normal rhythm.
Essentially, we've saved the patient from needing any drugs, needing an electric shock across the chest, and from suffering from some terrible complication of their rapid heart rate.
Just have to keep an eye, make sure it doesn't go back into that fast rhythm.
Do you want me to capture 12 lead?
Yeah, please.
And that's immensely satisfying.
We've got loads of special drugs ready for you. We didn't need any of them.
Oh, good.
We've managed to slow your heart rate down quite a lot just by doing that.
Yeah.
Can you feel it now?
Patients that come in when they're really unwell are often in shock. It's hard for them to understand what's going on. So as a nurse, I find it important to reassure them.
Does it feel slower now, though?
Yeah.
Fantastic.
Explain to them in a calm manner what is happening to them, what's going on around them.
What more could you want than a syringe and a tipping bed?
That's it.
It affects nothing to be kind to people and to give them that reassurance.
Fantastic. Well done, you man.
With Gary's condition returning to normal, Dr. Austin is now keen to investigate what caused his SVT.
So there's a number of things that can cause an SVT, including heart disease, inherited problems.
Have you been well recently?
Yeah.
Yeah.
Often when we see patients in the emergency department, it can be very easy to focus on the immediate problem that they have. However, it's a perfect opportunity to also approach other lifestyle risk factors that could put them at risk of illness in the future.
Do you still smoke?
No,
Pack that
I
in,
haven't
yeah?
smoked since my cardiac 2 years.
Yeah.
I want one.
one.
Don't drink a lot.
You drink a lot of booze? How much?
5 cans a day.
Alcohol is one of the main contributing factors, and alcohol can be quite an important cause of an SVT.
There's a rhythm problem with your heart. This is something that can be triggered by alcohol, and
Give up smoking.
good lad, yeah, that's
Don't
brilliant.
give that up. I can't give alcohol.
I'd imagine that making such dramatic changes to your lifestyle after decades of following the same path would be extremely difficult.
I'd advise you to reduce it slowly. You don't have to.
I could do that.
Yeah. If you stop it, suddenly that could actually be dangerous.
It's finding a balance.
You definitely need to start reducing it. And when you're down to a couple of cans a day, you need to start having days off because your body needs that chance to recover. It can affect your brain, your heart, your liver, everything. So,
I'll do that, doctor.
good man.
Alcohol is extremely cheap in the supermarket, so unfortunately, making the wrong decisions about our health is actually easier than fixing the problem.
Who do you live with?
My wife.
Yeah, oh, okay.
Yeah, that should be having eggs now.
Roshi, do you want us to give her a ring and tell her you're all right?
Yeah.
All right, that's fine.
I think that whole experience of being in the emergency department on your own is so much harder. If you've got a relative with you to comfort you, to talk to you, to take your mind off things, I think that makes a massive difference.
Hello, it's Austin calling from Hull Royal Infirmary. I've got your chap with me. He's doing really well. Yeah, he's stopped causing mischief. Yeah, he's absolutely fine now. But you know what? I want to keep him in hospital for the night. Yeah. The reason being, we need to keep an eye on him given what's happened in the past. He tells you he loves you and not to worry. All right, my love. You're welcome. No problem. Bye. She says she loves you. All right. He lives a long way away. He's got underlying heart problems, including the fact that his heart stopped in the past. I don't think I'm feeling brave enough to send him home. He'll probably just need keeping an eye on overnight.
Right, Gareth, we've got you all booked in and we've got all your paperwork. Thank you very much.
Like me out with that bongy.